that's my worry too, that there's especially in medicine, the margin of error is so small. We were just talking to Brett Taylor earlier, who is working in customer service. If you make a mistake, it's very different than if you make a mistake in a healthcare context.
Absolutely.
Dr. Minor, you talked a bit about your excitement for the promise of biomedical research, and I wanted to chat about um, bias that this risk of AI perpetuating biases that already exist in medical research because it's going to oversample overrepresented populations and undersample underrepresented populations. I can even you mentioned the examples of radiology. If there's a small or dermatology is also a field that's being transformed by AI. But if you just have a corpus of data that trains on lighter skin, you're not going to catch skin ailments. AI is not going to catch skin ailments from darker skin, and especially on the imaging contrast issues for darker skin. My understanding is that's a big deal. Uh, what are your concerns there about bias, and how do you see schools like yours working to guard against that in the experiments you're doing?
I think the concerns are real and the concerns are valid. And the AI is only going to be as good as the data on which the models are trained. And if that data used to train the models is biased because it's not inclusive, it's not representative, and then because the model has been trained on data not inclusive and not representative, it leads to erroneous conclusions when it's applied to patients, to situations that it's had no experience before, then that's a big problem. We have to focus. We're certainly doing it. I think every major center is doing it. We have to focus in clinical trials to make sure that there's diverse and equitable representation and participation in clinical trials. We have to make sure that data are identified based upon their source, particularly when, as you mentioned, the example of dermatology, when that can have a major impact on uh, the, the conclusions that are derived from an AI model that's trained on data. So I do think that this is going to be a current limitation because the fact is we generally don't have large, truly representative data sets for healthcare in this country because of the historic underrepresentation of underrepresented groups in clinical trials and other key studies.